Well, it is being called an acute neurological illness. The sickness has affected at least 8 kids in Washington state. One of them has died, but the cause of the illness is somewhat of a mystery. 2 doctors joining me now is KTVU medical expert Dr. Larry Burchett and a 6-year-old up there, Daniel Ramirez is the young man's name. He succumbed to this, but there's 7 other children that are hospitalized right now. Quickly explain what this is that they're dealing with.
First of all, I understand most of those kids have been released. So it's called acute flaccid myelitis. Myelitis refers to a disease of the spinal cord tract. So these kids present after they have kind of a normal cold, cough, runny nose, or flu-like illness, and then they get weakness, flaccid, limp weakness in an arm or a leg. And the young boy that died actually was kind of paralyzed from the neck down. And
this is something that is very rare. What are the odds of getting this? But there's a cluster up in Seattle, so it's a bit of a mystery.
Less than 1 in a million. It's extremely rare. But you're right. All of these cases together up in Washington make you wonder what's connecting these dots. The CDC and state public health officials are studying this, getting all the information we can to try to figure that out.
And the origin of this is believed to be basically tied to potential fecal matter getting into the system. Is that accurate? Or?
Maybe. One of the suspicions is that it's related to an enterovirus. So we've seen this before in 2014, 120 cases reported in this country, less last year. This year we're a little less than 2014. And there was an association at that time with enteroviruses. This isn't proven, but an enterovirus, entero means intestinal, so fecal oral. Those are transmitted basically by poo. So how can you prevent that? Wash your hands.
But you were saying that this is a bit concerning, especially the cluster in that area. And what is being done to study at this point? Who's the lead on this? Would it be the CDC?
There's going to be. That's a good question. I'm not exactly sure. So at the Children's Hospital, the state public health officials are certainly going to be involved. And then the CDC is going to come in also. A lot of information gathering at this point to try to connect the dots and answer these questions.
What age group is at risk?
So the disease is mainly under 21. Probably the average age is 5, anywhere from 6 months to teenagers.
Okay. And so the advice that you have, wash your hands, but otherwise there is no cure, right? So at this point, it manifests itself and works itself through?
We're not exactly sure. There's an association maybe with this polio-like virus. You can always wash your hands. We always tell people to do that. That's probably the best thing we can do to prevent that. Again, it's pretty rare, 1 in a million. It's nothing I would freak out, about. But, we do need to look into this outbreak and figure it out.
Something that we're looking at. All right, Dr. Larry Burchett, appreciate it as always.
Thanks, Ed.
Thanks.